Today I'd like to discuss with you some of the things around the fat grafting breast augmentation, specifically the limitations and the advantages of having this procedure over augmentation with breast implants. So one of the main advantages is, of course, that you are not having any foreign material inserted into your body. You're using your natural tissue, it's all your own, and the likelihood of any concerns or problems related to having foreign material in your body is straight away removed. Now, having your own tissue can be a negative sometimes as well, because fat is a natural tissue and it's metabolized by the body, and so we know that not all of the fat that we're going to transfer into your chest, into your breast, will survive, unfortunately. However, we know that with good technique and experience, we can get a take of up to 60-70%. So about 2/3 of it will survive. The look that you achieve with fat grafting is different to the look that you achieve with implants. Implants are made of silicone gel. It's much firmer compared to the fat from your own body, and it keeps shape very differently. So if you're after a very specific, really full upper pole, for instance, then you would definitely need implants. But what fat can do is it can definitely enhance the overall volume of the breast, and it can enhance the upper pole as well, but less so than the implants. The other, potential downside is that we can't always make the fat stay exactly in the same space. So depending on where the actual fat is placed and which layer of the subcutaneous tissue or in the breast itself will determine whether it actually stays there or whether it migrates. So surgical technique is paramount, and this is where I talk about surgical skill, experience. These are all critical to have your surgeon actually do it properly. It's not just about shoving fat into the breasts willy-nilly anywhere. That's not how it works. That's not how you get a good result. The other bit about the fat is you can't put too much in one go. It's really important to have good blood supply, and because there's no actual blood vessel going to this cell that we're transferring from one part of the body to the other, it's relying on survival by diffusion of oxygen across the membranes. So that means we can't overpack it, which means that if you do, what you're going to create is you're going to create dead cells, what's called fat necrosis, which will form into lumps and oil cysts and so forth, and can cause a lot of distress to patients, because sometimes they can present with a breast lump after the procedure. So again, experience is really important. Holding your horses and not going crazy for it in one operation is also really important. And planning to potentially, depending on how much bigger you want to go, planning on potentially doing it more than once is also quite useful. To be frank, in practice, most patients just want to give it one go. And if you're somebody who's going to be happy with having one operation and perhaps an increase of roughly about 1 cup size in one procedure, then this is maybe the right operation for you. If you want to go much more than that, you may need more procedures. So it's doable, but you need to have enough donor sites to work with, or you should just go directly to implants perhaps in that situation.